Lassa fever is a type of viral hemorrhagic fever caused by the Lassa virus. Many people who become infected do not develop any symptoms. However, when symptoms occur, they typically include fever, weakness, headaches, vomiting, and muscle pains. Because of these non-specific symptoms, Lassa fever can easily be confused with other illnesses such as Ebola, malaria, typhoid fever, and yellow fever. The Lassa virus belongs to the Arenaviridae family of viruses. It is a zoonotic infection, meaning it is transmitted from animals to humans. The main reservoir is the multi-mammatay rat, scientifically known as Mastomys natalensis. Understanding the source and early symptoms of Lassa fever is essential for prompt diagnosis and effective prevention. It is endemic, meaning it is regularly found in parts of West Africa, including Nigeria, Sierra Leone, Liberia, and Guinea. While the name can sound alarming, knowledge is our most powerful tool against it. The illness was first discovered in the town of Lassa in Nigeria, which is how it got its name. The primary carrier of the Lassa virus is the multi-mammatay rat, a common rodent in the region. Transmission to humans typically occurs through contact with the urine or droppings of an infected rat. Lassa fever is initially spread to humans through contact with the urine or feces of an infected multi-mammat rat, known scientifically as Mastomys natalensis. This rat is one of the most common rodents in the region. Once infected, it continues to shed the virus throughout its lifetime in its urine and droppings, creating many opportunities for human exposure. People often become infected when food or household items are contaminated by rodents, especially when rats gain access to grain stores inside homes. After the virus enters the human population, person-to-person transmission can occur, particularly in healthcare settings. Spread happens through direct contact with the blood or body fluids of an infected person. This may occur due to unsafe injection practices, contaminated bed railings or medical equipment, or when the virus enters the body through cuts, abrasions, or open wounds in the skin. Sexual transmission, mother-to-child transmission during pregnancy, and transmission through breast milk have also been reported. Strict hygiene and proper infection control practices are essential to prevent the spread of Lassa fever. The symptoms of Lassa fever often begin gradually. In about 80% of cases, the symptoms are mild and may include a slight fever, general weakness, and headache. However, it's crucial to remember that not every fever is Lassa. Proper testing is the only way to confirm a diagnosis. In the remaining 20% of infections, the disease can become severe. Severe symptoms can include bleeding from the gums, nose, or eyes, respiratory distress, repeated vomiting, facial swelling, and pain in the chest, back, and abdomen. Neurological problems like hearing loss, tremors, and encephalitis can also occur. Sadly, death can occur within 2 weeks in severe cases, usually as a result of multi-organ failure. While anyone can be infected with the Lassa virus, some groups are at higher risk of developing severe disease. This includes pregnant women, especially in their third trimester, for whom the disease can be particularly devastating. Healthcare workers are also at a higher risk if they are caring for Lassa fever patients without strict infection control procedures. Prevention. Lassa fever is a serious viral illness, but the good news is it can be prevented. First, keep your environment clean. Rats, especially Mastomys rats, spread the virus. Make sure food is stored in tightly covered containers and avoid drying food on the ground where rodents can contaminate it. Seal holes and cracks in your home to stop rats from entering, and dispose of garbage properly, far from living areas. Personal hygiene is also very important. Wash your hands regularly with soap and water, and avoid contact with the body fluids of anyone who is sick. In healthcare settings, prevention relies on what we call standard precautions. IPC is key. Healthcare workers should always wear protective equipment, such as masks, gloves, gowns, and goggles, when caring for patients with suspected or confirmed Lassa fever. Safe handling and disposal of sharp instruments, as well as regular disinfection of surfaces, are critical to preventing the spread within clinics and hospitals. If you or someone you know develops symptoms like fever, headache, and weakness, it is vital to seek medical care early. Early diagnosis and treatment significantly improve the chances of survival. The antiviral drug ribavirin can be effective if given early in the course of the illness. Do not try to self-medicate. Let a healthcare professional guide you. By working together, we can reduce the impact of Lassa fever. Share this information with your family and neighbors. If you need advice or need to report a suspected case, contact your local health authority. Staying informed and taking simple preventive actions can save lives. Let's protect our health together.